All right, folks, listen, I want to be respectful of everyone's time and make sure that we have enough time for plenty of discussion and questions. So I'd really like to kick it off. And I'll just start by introducing myself. My name's Gillian. My pronouns are she, her, and I'm based in Corpus Christi, Texas. So a lot of this presentation, I'm going to be talking from the point of view of a woman living in Texas, which is something that I know Judy Lerma, who is here with us, will understand. Yeah, why don't we just go around and talk a little bit about, again, just say your name, your pronouns, if you'd like to share them, where you're joining us from, and then just what made this workshop interesting to you. And Jackie, you are the next person on my screen, so I'm going to pick on you.
Hi, Jackie in Baltimore, Maryland. She, her. I work with the Maryland Progressive Healthcare Coalition, which is a statewide organization that works to support national improved Medicare for all. And abortion rights are in crisis right now. And so it's important to have good ways of engaging people on that issue when we speak to them.
Awesome. Awesome. Next up on my screen, I have Maddie.
Hi, everyone. If you start breaking up or freezing, I'll need to turn my video off because I live in rural Southern Colorado. I identify as non-binary, so my favorite specification for pronouns is whatever. I'm a retired physician and retired mainly because of moral injury from patients dying from treatable disease and suffering needlessly in our healthcare system. So I'm on the board of the Colorado Foundation of Universal Healthcare. And I'm pretty horrified by what's going on with abortion rights at this point.
All right. How about Patricia Chadwick?
Hi, thanks. Patricia from Sacramento, California. She, her. I've been working in healthcare, or volunteering mostly in healthcare issues around racial equity and disability equity. And I guess I was prompted because I was at an event a few months ago at a Health Policy Institute in San Francisco, and I asked one of the people who worked there, I said, are you promoting single payer healthcare? And the guy said, no, because if the federal government has the control, then they could deny reproductive rights to people. And I was like, I hadn't even thought of that. So I was like, well, it doesn't deter me from single payer, but I think, we needed to have mechanisms in place so that doesn't happen like it is now, actually.
Absolutely. Absolutely. Yeah, totally. We'll be talking about that for sure. Thank you so much. All right. I've got Laura next on my screen.
Hi, Laura Dominguez. I'm from Texas, Brownsville. And so why I'm here is I'm from Texas.
Yeah.
And we know the situation. I'm a nurse. So it affects our patients and me and my daughter. And it's why I'm here.
Absolutely. Absolutely. Brownsville. I still haven't gotten down to Brownsville yet, but I hope to very soon. Awesome. Very good. And yet another Texan. I have Judy here. Oh, I see Judy typed her introduction in the chat. She, her, San Antonio. Many years ago as a new nurse, I worked for 10 years in an inner city labor and delivery unit. It was educational, to say the least. Yeah, I will bet. I would bet. How about the last person I have here is Judy?
Yes. Pronounced correctly. Thank you very much. It's Judy Weiss from Chicago. I'm a member of the Illinois Single Payer Coalition and also of the Democratic Socialists of America. I've been a healthcare activist for a zillion years, ever since back in my many years as a freelance writer, working a lot from doing hospital marketing and realizing what an incredible waste of money it was. So I chose this one. I switched workshops at the last minute because it just appears to me that this is the issue of the day, and I need to see where reproductive rights and Medicare for all intersect. And I think that last question is a really good one that we need to examine. about
Yes,
the-
absolutely.
Yeah, about the federal government possibly interfering.
Yeah, absolutely. Absolutely. Very good. Well, thank you so much, Judy. I appreciate it. And it sounds like we all have some similar ideas in mind coming into this presentation. A lot of concern over what's been going on. So why don't I just start out, and I'm going to do a little, oh, we've got one more person here. Hey, Gail. Gail, would you like to introduce yourself to the group? We just gave our names and where we're calling in from, and what brought us to this workshop. That's okay, Gail. If you decide that you want to share, you can always drop your answers in the chat. For now, what I'm going to do is I'm going to go through a brief presentation that I have, and hopefully it will be brief. And then I want to leave lots of time for questions and discussion at the end. That being said, we're a pretty small group, and I'm going to be working my slides. So if you have a question, if you could just come off mute and ask it, that would be really appreciated, because I'm not going to be able to see if you raise your hand in the Zoom. All right, thank you very much. Why don't we get started? Okay, hopefully you should be seeing my slideshow now. Excellent. And so let me just start. So obviously, one of the things that prompted us to really want to do this workshop this year is the overturning of Roe, which has been a really traumatic event for a lot of women and other folks with uteruses throughout the country. So we're going to talk a little bit about what the impacts of that are. We're going to talk a little bit about the fight back for abortion rights. There were some really good victories, for example, in the midterm elections that we can look to for examples of how people are, dealing with this situation. And then I want to kind of suggest an alternate framing for the issue. Here we like to talk about sort of reproductive health beyond choice. And I'll tell you what I mean by that a little later. And then finally, I want to get to the idea of Medicare for all and reproductive justice. But first, I wanted to tell you a little bit about myself. So as I said before, I'm based in Corpus Christi, Texas. I've actually only lived here, though, for the past 3 years. Before that, I was very much an East Coaster. I grew up in New Jersey. My mother's family is Sicilian and my father's family is Polish. If you put that together, what you get is some really strict Catholics. And so I grew up in a very, very Catholic family. I'm talking dad's in the choir, mom is the leader of the prayer quilting group. My sister was an altar server, and I was a valedictorian in my CCD class. For those of you who are not Catholic, CCD is where you go to learn your catechism. One day, I was about 10 years old, and I came home with a little embroidered sticker like the one that you see here on the screen. I don't know, have any of you guys ever seen this before? These Roses for Life? This is a very, very popular fundraiser for anti-abortion groups, and still is sometimes today. It's sort of resurgence, but basically they would come into our CCD class and they would give these out, and then they would sell them after church in order to raise money to go march on Washington about how we shouldn't have abortion rights. Now, I just want to say, as a child, I was drawn to pretty things, and to me, this rose was shiny, beautiful. I thought it was the prettiest thing I had ever seen. So I took a bunch of them and I was putting on all my clothes, and I came home, and my mother was there, and she saw it and she said, "Gillian, do you even know what that means?" And I said, "Of course, it means that we're Catholic and we believe in the right to life." And my mother said to me, "Do you know what that means?" And I said, "Yeah, we're against abortion." And my mom said, "Gillian, that's a problem. We have to think about, there are all sorts of women who are in situations where they may need an abortion, women who are in, who have been victims of incest or rape, or women who are just in positions where they can't have a child. And I was absolutely shocked by this. I had never heard my mother say anything to contradict anything I had ever heard in church before. And I said, "Are you saying that you would have an abortion?" And this conversation is getting really awkward, right? Because I'm like 10 years old and my Catholic mother doesn't like to talk about sex. But she says, listen, I can't imagine what I would do in different situations. I can't imagine what I would do if I were in a position where I couldn't have a baby and I was pregnant. And that's really the point, is that we need to make sure that there's always an option for women who are in situations that we can't even imagine. Now, I'm a 43-year-old woman right now with no children. I love it that way. And I now obviously it is very easy for me to imagine all sorts of situations where I might want to have an abortion. But my mother's advice has always sort of rung in my head. And it strikes me now as really good health policy advice. We need to create healthcare that deals for situations that we can't imagine being personally in. So I think that, my mother, without knowing it, was really calling for single payer healthcare, and we'll talk about that as we go forward. So again, one of the catalysts for wanting to have this conversation right now is the situation of the reversing of Roe. And of course, as of June 24th, 2022, we are now living in the post-Roe world, which is kind of scary. Your mom sounds very wise. Yeah, on this issue, definitely. No, my mom is very wise. So some of the concepts. Sorry, I think I forwarded a little bit too far. Sorry, give me 1 second here. My slides are okay, here we go. So basically the kind of practical implications of the reversal of Roe, right? So first is the federal government no longer protects abortion access under the right to privacy, right? We have to remember that Roe versus Wade defended abortion not on the basis that abortion itself should be legal, but on the basis that abortion was covered by a woman's right to privacy. The consequence of this, right, is that now it's all up to the states. And states anticipated that at some point this would be the case, and 13 states, including Texas, put into effect trigger laws before this, right? And they immediately went into effect after the reversal of Roe. And basically those trigger laws said that that abortion to various degrees is now illegal in those states. Lawmakers and judges in the trigger states are now struggling to find ways to extend their control to non-trigger states. And we see this especially in Texas. We see this with the most recent Supreme Court hearing over mifepristone. I hope you guys have been following that. But basically a lower court judge in Texas attempted to ban mifepristone for the entire country. Yesterday, actually, the Supreme Court just gave a ruling staying that order. And so basically for the moment, mifepristone, which is a medical abortion pill, mifepristone is now available to the extent that it was before, and it is still available by mail. That court decision, though, will be decided sometime in May. I think May 17th, it's scheduled to be divided. It could be that the court rules that mifepristone, in fact, is not safe. And that means that the case would have to go to the Supreme Court all over again. Again, another way that we see this in Texas in terms of lawmakers trying to find ways to extend their control is in the passage of laws that that make leaving the state and assisting someone in leaving the state to have an abortion criminalized. So the consequences there is basically that we have this kind of patchwork of access, right? And patchwork is kind of a nice way to say it, because really what it means is that there are giant holes throughout the country. And when we have that kind of patchwork system, what we have are avoidable deaths, right, due to forced birth and underground abortions. Now, we all know, right, that abortions primarily now are performed medically. So the kind of specter of, we're going to have to go back to the old days of the wire hanger, right? That's not quite accurate. But what we're seeing now is that if, abortion pills can be criminalized, we're going to see, of course, a rise in underground production of those pills. And as we know with every other drug that we sell on the black market in America, when you buy on the black market and there's no regulation, you have no idea what you're buying. So that no doubt will be a problem. Another issue is the exacerbation of class and race inequality. And I'll talk a little bit more about that later. And then, although no one seems to care about women seeking abortions, I think it's important to note, right, that this causes increased trauma for people who are already at a bad position in their life where they need to seek out this care. So, lest we get caught up in the overturning of Roe as as kind of the be all and end all when things started to get bad, just a reminder, right, that things were not that great to begin with, right? And one of the main reasons why is the Hyde Amendment. Now, the Hyde Amendment was passed in 1976. This is directly after Roe versus Wade was passed, and it was definitely a response to that. And basically what it says is that federal funds cannot be used to pay for an abortion outside of certain specifications, like women who have become pregnant through rape or incest, or if their life is in danger. And every year since, Congress has reenacted the Hyde Amendment, re-voted on it, and supported it. Now, this, I want to point out, America is an outlier in this, right? Most developed countries, even super Catholic countries like Ireland and Italy, allow for publicly funded abortions. Now, what this means is that folks end up having to turn to employer-sponsored insurance plans, right? And in fact, 87%, right, of employer-sponsored insurance plans cover medical and surgical abortion services. But what that means is that only people who have private insurance have access to these services, unless you live in one of the 17 states that fund abortions through state healthcare. You might be familiar with the way that Medicaid works, for example, right? The Medicaid program has federal dollars that go into it, but also state funds as well. And so what some states do is, even though they can't use Medicaid federal dollars in order to pay for public abortions, they use their state funds in order to do it. 10 states in the US don't even allow private insurance to cover abortion. And I've sort of called them out here on the slide. And that is, again, this leaves tremendous, tremendous gaps. So people have not just been sitting here, right, since the reversal of Roe, right? People have been definitely trying to fight back. And I think one really good example is the midterms election of 2022, which had a number of different, which had a number of different kind of confusing outcomes, right? But one thing that was really clear is that when reproductive justice was on the ballot, people supported it. And so basically in Michigan, Vermont, and California, they approved amendments to the state constitutions that guarantee the right to an abortion. In Kentucky, voters rejected a ballot measure that was aimed at denying constitutional protections. And in Montana, voters actually rejected the Born Alive measure, which would have required medical workers to provide care to infants born prematurely, or in rare instances, surviving an attempted abortion. This is like kind of a scare tactic that Montana right-wingers were using. All right. And so, you know, Kansas, I think, is a good example of this, right? In Kansas, we had a ballot measure that was the no right to abortion ballot issue, right? So this is a ballot measure that was trying to assert that people in Kansas have no right to abortion. And it failed dramatically, right? We have 59% of the votes going to no. I think Kansas is a really interesting example here because I think many of us might think of Kansas as being a more conservative state, but we can see that even in conservative places, in traditionally conservative places, abortion is very popular and women are willing to fight to defend it, which is great. So this is where I want to kind of reframe the issue a little bit, right? People really like to focus on choice as the key issue in reproductive health, right? And obviously access to abortion is a huge portion of reproductive health. It's very, very important. And I don't want to demean the importance of it, but I want to kind of put it in the context of overall health, right? Reproductive health is about everything that keeps our reproductive organs and our bodies with reproductive organs in them functioning. So abortion access is one component, but also maternal health care, fertility treatments, contraception, pap smears, all the way down to tampons, right? These are all reproductive health issues. And the reason that I want to suggest that we kind of reframe this is just when people bring up choice, right? They do so because they want to divide us, right? They want to bring up a hot button issue that people might have some kind of knee-jerk reaction to. But when we think about things in the context of reproductive health overall, what we can see is that this is a kind of interconnected system. So this is from Tracy Whites, who's a professor at American University. Apologies for that terrible picture of her. But she points out the only alternative to abortion is childbirth, right, which has a 14 times higher risk of death than that of abortion. So in denying a person access to a wanted abortion, states are forcing people to assume significant medical risk against their will. This is something that we never talk about when we talk about abortion, is that the process of giving birth in this country is itself actually kind of dangerous. And so one of the things that we're telling people to do is we're forcing them into an overall reproductive health crisis. Again, this is not just about abortion. This is about how we give birth as well. And we know that the US is a tremendous outlier globally. We have the highest infant mortality rate in the developed world, as it were. We also have the highest, I'm sorry, the previous slide was the highest infant mortality rate. We also have the highest maternal mortality rate. So again, when we talk about a respect for life, right, we see that our current system actually doesn't have much of a respect for the lives of women or children who are being born into this world. And I like to emphasize that when folks talk about the right to life. Of course, you know, we're talking a lot about racial equity this weekend. And so I wanted to point out that the maternal mortality rates, as Sophia mentioned in our opening plenary today, there's a huge racial disparity. And so that means out of every 100,000 live births, 44 Black women will die. And that is a statistic that should shock all of us. Again, the infant mortality rates show us almost as big a disparity. And basically what we see is that aside from Asian populations, white folks have by far lower infant mortality rates, but we have, non-Hispanic Black folks with nearly twice as high infant mortality rates as white folks. So one of the consequences of this patchwork system is an exacerbation of racial and class inequality that already exists. We're forcing women into making a choice about whether or not they want to enter into a very dangerous moment in American healthcare. Something that sort of, kind of emphasizes this for me, right, is this this article that I read from the Texas Tribune, and basically, the Texas House in 2021, they had actually passed a law, and again, Sophia, who was on our opening plenary earlier, was really involved in fighting for this. I believe that Judy was as well, who's with us right now. But it basically would have lengthened coverage for children to 12 months. But basically, one of the senators who co-authored the state's restrictive abortion law halved the time period. Again, we cannot say that we are prioritizing life when we are literally taking away the supports to sustain life in its earliest forms. Just to kind of emphasize this point, at the Medicare for All hearing, it was a Senate Budget Committee hearing that happened last May. Abdul El Said, who is also one of our speakers for this conference, and I recommend that you watch his presentation, but he testified before the Senate Budget Committee.
I know my colleagues, my conservative colleagues here, care a lot about the lives of children, they say. And if we're serious about that, then what we would make sure is that every single mother had health insurance, regardless of her circumstances, so that she could access prenatal care services, that every single baby, right, would have the basic services it needed should it fall ill. But too often in cities like Detroit, because we had hospitals go from being public hospitals to being nonprofits to being finally for-profits, where they're constantly asking, how can I skimp $1 out of Medicaid because it's such a low-income community? Too many people, in effect, get locked out because of the churn of trying to stay on Medicaid at that moment where they're trying to safely bear a child and bring it to life. And so if we're serious about the well-being of infants, if we're serious about our life expectancy, then we ought to be serious about making sure that that transition into life is done with the full investment in healthcare for that mother and that baby. Thanks.
I just wanted to point out kind of two things that Abdul mentions there. One is the Medicaid churn. This is something that's going to be a huge issue in the coming months with Medicaid re-verification starting again after the end of the public health emergency for COVID, which prevented Medicaid re-verification. So people are going to be churned off of Medicaid, and when the Health and Human Services uses this term churn, but what they really mean is administrative delays and errors. So these are folks who are still, what Abdul is talking about is folks who are still eligible for Medicaid, but because of some kind of delay or an error, the paperwork was sent to the wrong place, they're struggling to even get access to Medicaid at this time period when they're giving birth. And this is an issue that's going to be huge in coming weeks, and months. So let's talk now a little bit about the Medicare for All Act. So as you probably know, this is the beginning of a new legislative session in 2023, which means that everything old is new again, and bills all have to be reintroduced in the current session. So that being said, the Medicare for All Act has not yet been reintroduced. It will be definitely in the first half of the year. It should be released in the House before June, and hopefully it will be released concurrently in the Senate. We've been hearing good things about the possibility of a joint bicameral release, and we're really hopeful about that. So right now, since we don't have the text of the 2023 version, I wanted to look at the text of the 2019 version of the bill. This is the House bill. And as you can see, it includes a million different comprehensive, well, 14 different comprehensive benefits. And all of them are awesome. But the one that I wanted to kind of point to here is number 7, which is comprehensive reproductive maternity and newborn care. So up until now in our movement, that has been comprehensive reproductive care has been sort of a shorthand for abortion. And we were told that that language was in there in order to protect people's access to reproductive care. Now, of course, the overturning of Roe throws into question what reproductive care actually is, right? And whether abortion is actually a piece of reproductive care. And that is the reason why healthcare now for the past few years has been really aggressive in terms of trying to lobby legislators to change the language of this law. Specifically, we want them to say the word abortion to make it clear that abortion is something that's covered. If we're very, very hopeful that in the newest version of the bill, that abortion will be in that language there. So it'll be like comprehensive reproductive maternity and newborn care, including abortion. And what that would do is it would actually guarantee abortion as a right in all 50 states. It's really, really critical right now in order to undo what's been done, that we actually say the word abortion out loud. We find that when we take the back route, like for example, defending abortion on the grounds of privacy, right? That the Supreme Court can then just decide, okay, abortion isn't included in the right to privacy. And so what we really need now is legislation that will actually use the word abortion and make it clear that we're saying that abortion is a form of healthcare. So this is kind of, this gets to the point that Patricia was making. If we were to, if we were to pass Medicare for all with that explicit language about abortion, in fact, it could actually have a really positive effect because it could help to even out this patchwork system that exists now. And it would override the state laws against abortion. This actually, to me right now, is one of the most exciting things about Medicare for all, is that it could be a way of actually guaranteeing abortion rights in the US. And it's something that we critically need, obviously. And it is, again, a huge part of healthcare, which is why I think that it belongs in a bill about healthcare. We need to start dealing with this issue as one of health as opposed to one of morality. And then just to put everyone in a good mood, I just wanted to kind of point out, sometimes people ask us, why do you want to inject divisive issues like abortion into, or frequently also divisive issues like race or immigration into the debate out of Medicare for all? Isn't this something that's hard enough as it is? And I just want to point out that actually, abortion rights are relatively popular in this country, the same way that Medicare for all is pretty popular in this country. Ever since we started talking after the reversal of Roe about the fact that abortion is a form of healthcare that we're interested in defending, we've been attracting lots of young women to the cause who see this as a way of achieving reproductive justice. And, in Texas, I know I've seen people, just really fighting back. Corpus Christi is a relatively small city, but we had 300 people out on the street protesting for abortion rights after Roe was overturned. That is popular energy. Again, we've seen the way that people vote when abortion is on the ballot in different states. That is popular energy. And so what I would suggest is that, actually injecting abortion rights into the way that we talk about Medicare for all, far from being deterrent, is actually attracting folks to our cause. So again, I wanted to keep that pretty brief so that we would have some time to talk. Just to start out, is there anyone who has any questions Yeah, Maddie.
So what I'm hearing you say, Jillian, is that having that in Medicare for all would be the legislative solution.
Yeah.
And I guess, okay, I just want to understand that because that is fantastic. I guess my only question is, would it also be a hook that would allow the Supreme Court to negate the legislation?
You know, I mean, it's anything is possible in this day and age. I think that you know, yeah, I think anything is possible. But I yeah, I think that still this is a really good way to get it on the books. But you know, also I want to point out just that in the abortion pill ruling that came down yesterday, that the Supreme Court seems to be kind of putting the brakes on things a little bit right now and sort of slowing down in their restriction of abortion rights. And even Justice Brown was you know, kind of talking about the importance of, you know, kind of pausing and evaluating before, you know, making kind of more broad condemnations of abortion from the court. Yeah, Patricia.
Yeah, I'm just, I have a couple of questions. One is like, are, you know, legislators going to be saying, well, I'll only vote for Medicare for all if it doesn't include abortion? And then the other question is like, you know, say it got passed with abortion, is it possible down the line that a Republican government could just say, we're going to take it out and we aren't going to fund that anymore, and we'd go back
Yeah.
to states, I guess.
Yeah. Yeah, so to take on, I'm sorry, your first question was about legislators who, yeah, you know, in the past we faced some resistance, right? Even from the folks who are the authors of the bill putting abortion actually into the language of the bill. But we have found less resistance this year, and there's a sense, I think, that we're going into a new moment, that we're in a new moment where you actually have to say abortion out loud. So even folks who have been really reluctant to include that in the language of the bill have been changing their tune in recent years. And so, yeah, I'm hoping that that's a kind of broader pattern as well. And then the second part of your question was
Whether, you know, say it got passed with abortion in the language, could the government down the line just say, we're going to,
yeah, government down the line could certainly do that, but they would be required to amend the law. So it would be a little bit more challenging. Yeah.
Okay, thank you.
Yeah, Judy?
Thanks. I think there's a real danger when activists and progressives try to anticipate the worst that the opposition might do and to base our own actions on that. I mean, you know, yeah, it's funny, but it's also serious. You know, there's a tendency to self-censor, and I think you know, until we are up against that, I don't think we should do it. I think we should go for what we believe is right, because that's the only way we get people who are on our side to fight for us, to put any energy into this.
I agree with you completely, Judy. Yeah, that was a chuckle of recognition. That yeah, I think you're absolutely right about that. Yeah. And you know, I mean, I think about my time in the labor movement, which is where I sort of started my activism. You know, you don't go to your employer and start out with a compromise package, right? You go to your employer and you tell them, the powers that be, and you tell them what you're fighting for and what you want. You start with your vision, right?
Exactly.
And then, you know, maybe you compromise down from there. But hopefully what happens is that your base gets so excited about that vision that they're willing to fight for it. And we've seen that throughout, you know, social movements throughout history as well. But yeah, Judy, thank you. That's a good reminder. Does anyone else have any kind of reactions? I wonder about folks who may be involved in their own states in things that are going on. Obviously, here in Texas, this is a hotbed issue. It is huge. I talked to the League of Women Voters down here in the Coastal Bend a couple of months ago about this, and you know, they have amped up their rhetoric, and so we've got you know, these like magnificent church ladies who are now like fighting for abortion rights and saying it out loud, and that's pretty spectacular. What have you all been seeing in your states in terms of folks sort of fighting back against the restriction of women's rights and the rights of other people to have abortions as well?
Well, I was at a hearing in California in Sacramento at the health committee of the House, or whatever they call it. And a bill was proposed to that would protect any healthcare worker in California who provided abortion care to people from another state, because you're trying to, like, you can't travel outside to get, whatever. So I thought that was good. And I don't think anybody was against it, California, of course, but, so there was other bills that people, were pro and con, but that one I think everybody supported, so.
No, that's spectacular. That's really good to know.
Yeah.
Really good to know. That's awesome. So Jackie, you had your hand up?
Yeah, Maryland General Assembly just closed and passed a bill to passed a constitutional amendment, which has to be ratified. It won't be ratified until 2024. But it's a constitutional amendment for abortion rights. And we already have, we had a law passed like 20 years ago, but this is much stronger. And our governor is also poised to, he's trying to position the state to have resources available to provide abortion care for people from other states. So I think,
that's really amazing.
yeah.
I hadn't actually heard about that in any other places. So the idea would be to actually take in refugees from states that don't have legal abortion and to be able to provide abortion care.
I think he's stocking up on mifepristone. But I don't know what else he's doing. I'm not as up to speed on this as I'd like to be, but I know that's one thing that he talked about. And yeah, I do think there's been kind of general statements of trying to be welcoming for people coming here to have abortions.
That's really cool. That's really cool. Excellent. Maddie, you had your hand up?
Yeah, so we also, I'm from Colorado, which has actually a supermajority in the legislature, and we've got, I think, 3 weeks left of our session. And similarly, there has been a bill going through to protect abortion refugees and providers. Interestingly, in this state, a constitution, citizens can put constitutional amendments on the ballot, and one passed several years ago which prohibits the use of public funding for abortions, which we're trying to overturn. So we're kind of stuck in that middle place. But I'm not sure how. We actually have a single payer a state level single payer thing we're trying to push through, which includes reproductive rights as allowed by law. And I'm just kind of wondering about actually putting the word in there, though legally at this point, public funds still couldn't be used. So it's kind of a rock and a hard place.
Yeah, right. Because you said that you have a state law that in Colorado that prohibits use of state funds for abortion as well. This Yeah, that's really tough. We would basically have to, this is like, this has caused problems before for other single payer bills as well. So for example, I am never going to remember exactly what the state was, but there was an effort to pass single payer that actually seemed like it was going pretty far. But then sort of someone did the math and realized that because there was a law in the books prohibiting publicly funded abortions, and the bill contained absolutely no language about abortion, what that meant was that if that Medicare for All package had passed, it would mean that that abortion would essentially be illegal in that state. And so that's when Planned Parenthood, for example, came out against that Medicare for All measure.
Well, that actually happened in Colorado in our 2016 Colorado Care Law.
I think that's
And
what I'm
so
thinking of. Yeah.
we've been, we actually are much better with our relationship with Gnarl and the other Cobalt, I guess is what Gnarl is called now in Colorado. So, you know, we are cultivating those relationships and trying to work in tandem to be reversing those restrictions.
That's awesome. Yeah. So that's like, I mean, I think that that like is a really good sign. And I think that when we join forces like that with reproductive health organizations, that we make our movement a lot stronger. And we eliminate one of the grounds in which, you know, we can be divided from other progressives as well.
Absolutely.
Yeah. Very cool. Very cool. So I'm realizing, did anyone else have any other questions? I wondered if there was any organizing going on in your states. I hear a lot about legislation, but do we see a lot of people on the ground around these issues where you live? Yeah, Maddie?
Yeah, so one thing I've been really loving, I live in a very red county in rural Colorado, and I had a local healthcare group here in Fremont County, which we still have, but we actually had a book group. So we've been working on deep values conversations and, you know, brave angel type stuff to bridge the divide. And we started some conversations that at this point we're doing monthly. But it's been really interesting because like this last time we had a new lady who is very anti-abortion, and just sitting down and talking to her, finding out where she's coming from, talking to her about our experience, like my experience as a physician, taking care of 9 and 11-year-olds who were raped by family members and are now pregnant, and the consequences that has physically on a child. And, you know, talking about, you know, exactly what you were talking about, Gillian, which is pointing out the discrepancies about being, quote, pro-life, unquote, but not really caring about the life of anything other than a fetus between conception and birth. So, you know, it was really interesting because people listen, and when they hear you understanding their point of view, then they're more willing to listen. And it's been a fascinating experience.
Yeah, I think that's excellent. I think that's excellent. And that's one of the things that's going to be really critical going forward is being able to have those conversations with other women and with folks who are against abortion and really talking through the values of it. Because I think that when people do talk through the values, we find that we have a lot more commonality than we have difference. Yeah. Excellent. Cool, cool, cool. Anybody else have any organizing that they've been a part of or that they're seeing in their area? Or has a lot of this movement just been in the legislature? It's interesting.
We actually have, we do have a lot of organizing. Like I said, I'm on the board of the Colorado Foundation for Universal Healthcare, and we are doing a ton of stuff here. We have, local government resolutions going on supporting Medicare for all, and a lot of them are happening. If you hear some weird background, that's my dog needing jerking. So, yeah, I mean, actually, we have been really busy, and with this new bill coming up for single payer, it's been pretty amazing on all levels of the organizing part of it.
Spectacular, spectacular. That's awesome. Judy, how about you?
Yeah, I know there's a group in Chicago called the Chicago Abortion Fund, and it's mostly Black women. It's on the South Side. They're very active on abortion rights. And those of us in the single payer movement have been kind of making connections with them, trying to link the two issues. I think, for a lot of people who are in the abortion rights movement, that's a more pressing, urgent issue.
Yeah.
So I think this might be a long-term thing, but it's an area where we can overlap those issues and become more diverse. So yeah, and I think somebody, Jackie, just put up something that Baltimore also has that. A lot of cities have those. And there's even an organization or some kind of way of giving to all of those at once. I can't remember what it was. I remember I found it online somewhere. So, that if you give through this, it's like it acts blue on a much smaller scale.
I think
And
you're
they don't
thinking of
harass you.
NNAF, right? The National Network of Abortion Funds, I think.
Yes, that's it. Yes. Thank you.
Yeah, absolutely. They're really awesome. They also do a lot of really good work escorting women and
Right.
ensuring that women have access to pre and after care too for abortions. They're really awesome.
Right.
Yeah, very cool, very cool. And then Jackie, you said that there's an abortion fund in Baltimore. That's really awesome. I think I just want to highlight what Judy was saying about building relationships with abortion rights groups. This is something that, for a long time, a lot of folks in our movement have said, listen, universal healthcare is tough enough. Don't inject these divisive issues into it. And that's a real problem, actually, in our movement. And one of the ways that we're going to have to rectify that is by making sure that we say these things out loud and making sure that we explicitly reach out to groups that are involved in these fights, because they are critical it's a critical perspective in our movement as well. Yeah, Maddie, go ahead.
Yeah, I so support you in that statement, because a lot of our work right now is intersectional. And people, like you said, say, well, my issue is this. I don't have time for that. But actually, they all affect each other. And one of the things that I've really come to realize is you can have a coalition partner that you let them do their work, you're doing your work, but we share each other's information with our membership, and that alone makes a huge difference.
Absolutely, absolutely. And the more relationships we can build with those different groups, I really think, we can see that there's been a lot of success in the Medicare for All movement in places where we have multi-issue groups involved. So I think that that's like a real sign that when we broaden our outreach, really great things happen. Yeah, Jackie.
I was just clapping to.
Oh, sorry, I thought that was a hand raised.
No.
That's awesome. Patricia, I see that you're off mute. Did you want to say something?
Yeah, I was also going to just say, like making connections with people with disabilities, because women with disabilities especially have been very discriminated against in reproductive health.
Oh my gosh, yes.
The tables aren't even accessible and stuff like that. And, I think that kind of issue, the issue of being denied care is very concerning to that group as well.
Absolutely. Yeah, absolutely. That's so true. Yeah, that's a real struggle, right? For folks with disabilities is accessing any kind of reproductive health care, let alone abortion, right? Yeah,
Right.
absolutely. Yeah, Maddie?
Again, I totally reinforce that, Patricia. The way I actually found out about Healthcare Now was back in 2017 when I went to your meeting in New York, and I was with my sister who's paraplegic, and she passed away this past July. A lot of it due to the dysfunction of our healthcare system. And, we were turned away again and again and again by people who said, well, we don't take care of people with that kind of disability. And just access to care was almost impossible. And she's dead now. So it's pretty horrific.
Well, first of all, I'm so sorry for your loss. I mean, it's, we hear these stories every day, but it's important to stop and let them hit you. Yeah, I'm so sorry for your loss. And you're right. It's a systemic problem. And that's one of the things that we at Healthcare Now have been trying to do is really to build some of those connections as well. There's actually a really great in the Illinois Single Payer Organization. They have a long-term care group that specifically talks about the intersection between Medicare for All and disability rights. And I think that could be a really cool model for the rest of the country as well. Oh, Jackie says Maddie's sister Sydney was a friend, a wonderful woman, and a Medicare for All activist. I'm gonna suggest that once this day of conferencing is over, that we all find a place to raise a glass to Sydney and to commit, our next few days in the struggle maybe to her memory. Yeah. Thank you so much. Judy, yeah.
This is maybe a little off topic, but because we're talking about disabilities,
Sure.
it might be a good idea. I would strongly urge that the next conference include captions on these. I don't know how expensive or how difficult it is, but I'm just thinking of at least one extremely important activist here in Illinois who is having language processing difficulties, and I haven't seen her name listed on anywhere here. And I think that's because she can't do it unless there are captions.
Oh, okay. Well,
I'll
you
have to ask
should-
her later, but
So you can actually enable captions here. And if
oh, you can?
look,
I didn't see where
Yeah.
it was. Okay.
so if you look down on your Zoom, you see the panel that says like security, participants, chat, share screen. It might look a little different on yours. But one of the options is
Yeah.
captions.
Oh, now I'm
and-
getting them. Thank you very much. I had tried that earlier on one of the other ones and it hadn't worked. I saw
Oh.
it there and it was grayed out and it didn't work, but I see you have it. Okay, so I apologize for taking it to task.
No, that's okay. It's the kind of thing where accessibility features actually don't mean that much unless you publicize that you have them, so that the folks who need them are aware.
Yeah.
So we need to do a better job of that in the future for sure. That's
So
a great
thank
point.
you.
Problem. Yeah. Great. Listen, I'm gonna make a confession to you guys. I had forgotten that we had an hour 15 for this workshop, so I had actually planned for it to end a bit earlier. And so I don't know, did anyone have anything else that they really wanted to talk about? Any other questions they wanted to ask or issues they wanted to raise for the group? Well, I'm gonna hang out in this room, so if you want to hang out and chat, like by all means, please, hang out with me. But for the rest of you who want to go and grab a drink or something, I release you into the world. I really want to thank you so much in joining me for this session. I think this is such a critical issue, and I also think that this is one of the ways that we are going to recruit young women into our movement, and young trans men and non-binary folks who have uteruses and care about this issue as well. And so I'm really excited that we're able to say the word abortion out loud these days. And I hope we'll keep doing it, and loudly and proudly. So thank you all so much. I really appreciate you.
Thank you, Gillian. That's great.
Thanks.
Thanks.